essentially what's happening is there's a budget reconciliation process underway, which is to say a fast track process for enacting changes to federal spending that is in part going to be reduce Medicaid spending by about $625 billion over the next 10 years. And so the proposal that's out there right now has a number of different pieces, but the biggest ones that are really going to impact Medicaid are one, changes in how redeterminations and eligibility is determined. So the process by which people are qualified for the program and have to be verified occasionally in order to ensure that they're still eligible to participate. And so that's going to be a big piece of what's happening. There are changes in how the program is financed from the state side, because Medicaid, unlike a lot of federal programs, is a state-federal partnership. There are what are called provider taxes that some states use to raise money from healthcare providers, use that to make their state match as part of their state contribution to the program, and then turn around and pay that back to the same providers that they tax it from. So it's a way of sort of gaming the system and artificially boosting the state's contribution to the Medicaid population. And then third, there are work requirements that are a big piece of what is being required in the new bill. And what that means is that essentially, in order to qualify for Medicaid, an individual would need to be engaged in at least 80 hours of work or work adjacent activities in order to continue to participate in the program.
And that's 80 hours of work per month.
Per month, yes, correct.